Welcome to After the Move to Memory Care. This is a community dementia education program of Alzheimer's San Diego. Really happy to be with you here today. My name is Amy Abrams, and I am the Director of Education with Alzheimer's San Diego, and very pleased to be co-presenting today with my colleague and my boss, our President and CEO, Eugenia Welch.
Morning, Amy.
Good morning.
I'm not sure who's the boss, but I think for today you're the boss.
So for those of you who haven't met Eugenia in the past, she has been our president and CEO at Alzheimer's San Diego for a couple of years now. But prior to that, worked for a very long time in residential care. She was the executive director of a residential care facility for the elderly that specialized in memory care. Eugenia, anything you would add to that?
No, I mean, 24 years in assisted living in California has given me a pretty good background to be able to help with today's program. So I'm happy to be here to be able to do that.
Very, very grateful to have her expertise with us here today. Here is our agenda for today's program. I'm going to talk briefly about some tips for making a smooth transition into residential care. Then Eugenia is going to take over and talk with you about how to sort of have a successful relationship with the community staff and the administration, working with them, the ins and outs of what really goes on behind the scenes in residential care, and how to make that relationship as positive and productive as possible. We will talk about caring for yourself during this transition. This transition to memory care certainly can be challenging and difficult for the person who's living with dementia, and it has impacts upon everybody in that person's support system as well. So we'll talk about ways to care for yourself and make these adjustments to a new relationship. Now, we'd be remiss if we didn't acknowledge that much of what we're going to be talking about right now in terms of the admissions process, procedures, once a person has moved into residential care, a lot of this stuff is in flux right now. Things are changing kind of daily. We're trying very hard to keep up with what's going on in the world of residential care, along with other types of supports for people who are living with memory loss. But while we are still in this period of COVID-19 and sheltering in place and quarantining and extra infection controls, a lot is different right now. So as we go along, we will be trying to address those things as we can, but feel free to ask questions, get some clarification on any of that as you need. Okay. So I'll start now with some tips for making a smooth transition into residential care. Just a few words on this. First of all, the admissions process is different depending upon the type of community you're looking at moving your loved one into. There will always be an assessment of some kind. These are generally conducted by a nurse or a social worker or an admissions coordinator. The titles can be different depending on the type of the community, the specific community. But the assessment is generally an in-person, in your home or in the person's current living environment affair. Again, today that may be different. This may happen primarily by phone. This may happen by video conference at the moment, but traditionally the assessment process is done in person so that the facility is getting, facility and community, by the way, I use those terms interchangeably, just out of old habits. The admissions process is, the assessment process is intended to give that community staff an accurate picture of how the person is doing, how they're functioning, what their personality, their behavior, but also what their activity of daily living needs are in their current environment with their current support that they've got. It's really important that families be very honest and direct with the community at this point in the process. There is this tendency for people to want to paint a different picture. Sometimes people are trying to paint a picture that's a bit rosier than how it really is, right? It can be difficult to talk about how the person with dementia is functioning in front of them, right? If they're telling the nurse, oh, I'm fine, I don't need any help with bathing, I do all of that by myself. Sometimes the family is reluctant, or the care partner is reluctant to provide clarification. Sometimes there's a tendency to paint a more dire picture, right? Either consciously or unconsciously. Sometimes people are depicting the person as less functional than they actually are, because they really want to make sure that they get into the right level of care, for example. I really encourage you to provide a direct and honest assessment. Provide that detailed background information that they ask for. Sometimes you'll get a very lengthy questionnaire or survey, or they'll want to have an interview with you to really learn the ins and outs, not just functionally how this person does, but tell us who they are. Tell us who they have been throughout their life. What's their personality like? What are some unique characteristics about their personal history, their preferences, the things they love, the places they've lived, the type of work and recreation that they did. All of these things matter. It's really important that you help the administration and the staff really, as best you can up front, gain a pretty complete picture of who this individual is. It's impossible to fully flesh out the picture of who any one individual is through a questionnaire, of course, or through that assessment process. But we really encourage you to share as openly and honestly and completely as you can. This is going to set both of you up for success in that transition, making sure they're at the right level of care, but also that the staff know those ins and outs of their personality and their preferences. When it comes to setting up the new room or the new apartment, depending upon where they're moving, know that there are experts out there that can help you with this. Individuals who understand facility care and the transition from home to residential communities. But if you're doing this on your own, we encourage you to think about the setup, the flow that is familiar to this person as much as possible, while bringing as little to the community as you can, so that you want to sort of strike this balance of having enough of their things that there is a familiarity. They recognize their most favorite paintings or family pictures, for example, objects that make them feel cozy and feel at home, furniture that looks familiar to them, if that's possible, depending upon where they're moving. You want to strike this balance between not too much of that stuff, keeping it simple and paring it down, but also helping it feel and look and feel familiar, so they can kind of move about their space as much as they can, the way that they used to when they were living in their previous home. And when it comes to the day of the move, consider this very carefully, right? Work with your support system so that you've got some backup in the run-up to the packing and also the actual day of moving. And so that you've got some tangible support, but also some emotional support on what is likely to be a difficult day, right? Maybe plan for somebody to take you out for lunch or dinner, or come with you that day if you're feeling like you need that support. Consider the right time of day for making this transition. Talk with the staff about what is the time of day that this person functions at their best, right? And try to use their sort of natural energy flow, their rhythms of their day, when they have good energy, when their mood tends to be brightest, for example, and try to time the move accordingly. The staff will work with you on this. If there is an activities coordinator, and at most memory care communities there will be, work with that person to get familiar with the calendar, the schedule of what's going on, because if there's any way that if the person really loves music and you can bring them in at a time that a music program is going, get them integrated, right? That is, you can work with the staff to facilitate your departure, and that'll be a lot easier on both of you. So a lot of people ask us at Alzheimer's San Diego about how much should I be talking to the person that I care for about the fact that they're going to be moving, or that I'm looking into different placement options, for example. There is no one right way to do this. I can't emphasize that enough. We are happy to talk with you about your individual situation. This is one of the conversations our social work team spends a lot of time supporting families around. But there is no universally correct way to do this. It really depends on that individual person, their capacity to understand. Do they know that they have Alzheimer's disease or some other form of dementia? Do they understand the toll that caring for them is taking on their support system? Do they know that they need this assistance? Right? If a person has no insight into any of those needs about themselves, it's not going to be productive to try to convince them at the time of a transition into memory care that you're moving because you really need more support than I can provide to you. For some people, that conversation is quite possible and can be very positive and very productive, and they can actually be a part of it. They can be a part of the decision, part of the conversation. For many people, that's impossible, and the transition simply needs to just happen, right? Without kind of getting into the weeds, getting into a negotiation, without focusing on the details of what's happening, right? It can be much easier on them and also on you to simply make it happen, not engage in a lengthy conversation, dialogue, debate about whether or not this is happening, when it's going to happen, and on the day of the transition, right? For many people, the most helpful strategy is just to walk in, get them integrated with, sit them down at a delicious lunch with some nice friendly faces, or get them into that music program, for example, and for the support system to simply walk away without there being a discussion about that. That's very difficult. I know that's very easy for me to sit here and suggest that you do. This is by no means an easy thing to do, but remember, there is support for you around this. Support in discussion groups, our social work team, and of course, your own natural support system. Don't hesitate to reach out and get help around this. When it comes to making those initial visits, many communities are going to suggest that you not visit for a time, a couple of days, in some cases a couple of weeks. These are just recommendations on the community's part, and they're based on their experiences, right? Working with other families, seeing what's been successful for other people. You know yourself, you know the person that you care for, and these are suggestions, but you can time this differently. Many communities have opportunities, little observation rooms, if you will, so that you can come in sort of the back way, go into an office and look through a two-way mirror and see your person out in the living room, out in the activities room, see how they're engaging, check in on them, watch the staff and see what's happening in terms of activities and engagement without the person actually being able to see you and to know that you're there, to cause that distraction that sometimes can happen. So work with the community staff on when to time this visit or these initial visits, and exactly how you want to integrate them. You're very likely in the early days, weeks, maybe even months after you've placed somebody in memory care, you're very likely to hear them asking you to go home, asking questions, telling you that they need to get out of there. Just know that that is normal. It's painful. It's hard to cope with, but get some support for yourself around that. And above all else, just go easy on yourself. Give yourself time to adapt, to cope with. This is grief, this is change, this is loss for both of you. So go easy on yourself. Okay, I'm going to hand the remote over to Eugenia, who will now talk with you a bit about working with the community staff and administration.
Okay. Good morning, everybody. As Amy mentioned earlier, I have worked in assisted living for a long time, but I also wanted to mention that I have had the responsibility of placing 2 of my family members in a residential care community, both of whom had Alzheimer's disease. So I do understand from both sides of the coin, and I feel like that experience really gave me a better understanding for the career path that I had at the time. And both of those family members were in Connecticut, and I was managing from California, which only adds another layer. So when working with the community staff and administration, as Amy mentioned earlier, the #1 thing is really about communicating with the staff. You might think something is a silly question. You might think you're the one and your family member is the only one dealing with something. I guarantee you it's probably not the case. The facility staff really has heard a lot of different things over the years. So the most important thing really is just communicating with the staff, and that's going to get you a long way. Be upfront and open, ask your questions, raise your comments. If you have a concern, the facility wants to know that too. So definitely communication with the staff is very important. So one of the most important things when moving into a community is the move-in process itself. It's gonna be arduous. You see all those stacks of paper, and sometimes in the slide that Amy has up, and sometimes it's gonna feel like that's exactly what you have, stacks and stacks of paper. A lot of these things are required for the facility to have to fulfill their license, and some are requested, but most of all, they need everything to be able to care properly for your family member. They're not asking for things just to give you busy work. They really need this stuff to be able to care for their residents. So just as we go down the list, power of attorney or conservatorship, those are not required. You don't have to have a power of attorney, and you certainly don't have a have to have a conservatorship. But if you have these things, it's imperative that you give the facility copies so they have them in their files. As we go through these things, I'll let you know that a lot of this is important for them to have so they can get your family member care. A lot of it is so that if they have to call 911 and they're sending a resident out to the hospital, they can share this information, share these wishes with paramedics and hospital staff so that your family member is getting the actual care that you want and hopefully you've all talked about and decided on. So the power of attorney, conservator paperwork, also any advanced healthcare directives. These used to be called the living will, you know, the thing where it says what kind of measures you want taken in case of an emergency. So again, very important that you have those copies and you're giving them to the facility. The PULSE is a form that's actually required by the state. It's called, PULSE stands for the Physician's Order for Life-Sustaining Treatment. This is really something that's imperative. It's a one-sheet document. You're going to fill it out with your family and your doctor, and the doctor has to sign off on it. It's gonna say whether you want extreme measures, comfort only, and these are really important conversations for the family to have and to talk with your doctor about. You can change the PULSE. You can maybe at one point you're filling it out and you're saying, we want every measure possible taken to treat our person, and then maybe a couple years later you change your mind and you decide you want comfort measures. That's, you can change the PULSE at any time, but you have to bring it into the facility so that they can have it on file. It's something that the paramedics know to look for, and so they have to have that on hand, and it's very important to be up to date if you want to make changes. The health information privacy waiver, that's so they can share information with other medical professionals, so that when doctors want to know what medications the resident's taking, maybe the resident goes to 3 different doctors. This is so the facility can share information among the different physicians, can share information of, is the resident taking their medication properly, or are they refusing medications? What's going on with them? So that's really important for them to have. And it also allows the facility to gain information from the physician. As you know, sometimes you go to a doctor and you're there for the appointment and you get back and you have questions. That happens with the facility also, because facility staff is generally not attending the doctor's appointment. So it gives them the opportunity to call the doctor and ask those follow-up questions and get more information. Insurance information, of course, they need to have that to be able to pass on for doctors, pharmacies, anyone who might be billing. The facilities are not billing your insurance. As we know, facilities, communities, they are private pay unless you have some sort of long-term care insurance, or possibly the assisted living Medi-Cal waiver program. But the health insurance information is simply so that they can make sure medical professionals are billing properly and have that information. And of course, identification, which is something you'd be surprised, but it's something a lot of people don't have. For a lot of people, when we stop driving, we don't have our driver's license anymore. It gets put in a drawer. So it's really important to have some sort of identification. And it might be that it's expired, but something with a picture, information on it. If you can get an ID card for the resident, that's great. You can get that through the DMV. Of course, right now that wouldn't be possible. With the COVID restrictions would make it very difficult, but just something to think about. Make sure you have some sort of identification. So for residential care, for healthcare, it's important that you need to know that you are able to consent for the resident. The resident, if they're not able to give consent for themselves, you are able to do that for them. And no treatment or changes in medication can happen without you knowing about it, if you so choose. These are things to talk about with the facility. Some people are quite happy once their person moves into a residential care community to turn all this responsibility over to the facility and let them communicate with doctors and authorize medication changes. And some families want to really be involved in all those decisions. And some are in between. So it's all about a communication and conversation with the facility staff to make sure you are at the level of involvement that you're comfortable with. You can say that you don't want your person to start on a new medication without being informed of it ahead of time. That's very common. You can say you don't want a physical therapist to start without being informed about it. Again, very common. And it's up to you what you want. Just make sure you're communicating properly with the facility so that they know. You also have the right to choose any provider you want for your family member. Sometimes facilities will say that they have a house doctor that comes in, or they recommend someone, a physician, a physical therapist, whatever it might be. And that's great. And you might very well want to take the facility recommendations for convenience, or you're moving into the area and don't know someone. But if your person has been going to the same physician for 20 years and you feel like you have a good relationship with them and you're comfortable with them, then absolutely you can keep that person as their practitioner. So you have the ultimate choice in choosing the providers. Medications, mobile therapies, and other healthcare services, same thing. If the doctor writes an order for a physical therapist to come in, or an occupational therapist, sometimes facility might recommend the services of a psychiatric nurse to be able to provide some counseling, or a visiting geriatric psychiatrist, those kinds of things. but you have the right to say yes or no. And again, just to reiterate, the medications. Very often someone might not have an allergy to a medication. Those things would be documented in a health chart, but maybe they had a strange reaction or a adverse reaction to a medication that might not be documented, but you might know about it, so that if you're giving approval of a new medication and you see a doctor's wanting to start something, you can say, oh, no, please not that. That doesn't work for my family member. So it gives you some authority there, because the thing to always remember is that you know your resident better than anyone else. The facility is going to get to know them very well, but the facility is going to know them in this stage and at this time. You know your person from your whole life, or as long as you've had a relationship with them. And so that historical information is very important to the community. And we always ask that you share that with them. Attending appointments, most facilities will offer the service, or pretty much all of them, I believe, will offer a service where they can drive residents to doctor's appointments. Some of them will also offer a service that a staff person can go with them to appointments. Very often there's no charge for driving the resident to the appointment, but there probably is going to be a charge for having a staff person attend the appointment with them. But if at all possible, if a family member, a friend, someone can attend the appointment with the resident, it's very helpful. It's very helpful to be able to get the information back from the physician to the facility. It's very important to be able to share with the doctor what's going on. If a resident is attending a doctor's appointment, even with a staff person, usually the facility nurse is writing a note, sending some information over to the physician so they can look at it, and then hopefully the physician is sending a note back to the facility, but nothing takes the place of that interaction and being able to ask questions during an appointment. So when at all possible, if you can do that, that's really important to the success. Emergencies and hospitalizations. We like to think it's not going to happen, but I mean, pretty much at some point, everyone's going to have some sort of an emergency. The facility is also bound by certain regulations where they have to send a resident out in certain cases. For example, if a resident falls and hits their head, even if they say they're fine, they didn't lose consciousness, it's a best practice and it's a licensing requirement actually, that a resident be evaluated at the hospital. So there are going to be times when 911 is called and a resident is sent out to the hospital. The facility, of course, will call you right away to let you know, in hopes that somebody can meet the resident at the hospital to be with them. But the facility cannot call the family first. Sometimes families will ask, well, my mom might complain that she's having chest pain, but it's not really a heart attack, it's anxiety. Please don't call 911, call me and I can talk her out of it. The facility cannot do that. They are required and bound by their license to call 911 first, and then they will call you and let you know what's going on, but they cannot have a family veto getting the residents the medical treatment that they need. So that's really important to know, because it can be upsetting.
Can I interrupt to ask a question on behalf of one of our participants? It's really relevant to this specific topic. Can a resident refuse? You're talking about families can't veto certain things, but what about the resident themselves? If they didn't want to go to the hospital, if they did not want that doctor-ordered physical therapy, what is a resident in memory care's right to refuse treatment?
The residents absolutely can refuse. Residents can refuse to participate in physical therapy. No one's going to force them. Residents can refuse medications. A facility they'll try multiple times, of course. If we know this is your blood pressure medication and you should take it, they're going to try a couple different times to ask the resident to take it. But if they refuse, they absolutely can. In memory care with the EMTs and 911, it's a little different, because yes, the resident still has the right to refuse, but if an EMT through their expertise evaluates that this person really needs to be seen at the hospital, they're going to do their best to try to get them there. In assisted living that is not deemed memory care, the resident can absolutely refuse and the paramedics will not take them. So in a secured memory care neighborhood, it's a little different, but in assisted living, the resident can absolutely refuse. Is that good? Okay. So the one difference there is hospice care. I highly recommend when you're looking for a community, you ask them about hospice care, what their relationship is with hospice. Do they have a hospice waiver so that they can have residents at end of life in their community? Nobody likes to talk about hospice, but at some point it's going to come up, and it really is the best thing for someone if they can get on a hospice service and have a dignified, comfortable end of life. And one of the things about hospice care is that by going on hospice, you know that this person has a finite amount of time left. We're going to provide them with a dignified and comfortable end of life. And then the facility doesn't have to automatically send the resident out to the hospital. You know, going out to the emergency room or going out to the hospitals because there's something's going on, you want to try to fix it. By virtue of being on hospice, you're sort of accepting that you know the situation can't be fixed, and so that you're just trying to keep the person comfortable. The other benefit of hospice care is it will provide some extra supportive services to the resident and to the family. They provide social workers that can help talk with the family and get them to, you know, understand and deal with the end of life situation. They will also talk to the resident and see if they have anything they need to process through their end of life. They have chaplain services available. They also have nurses that come out and check on the resident more regularly. And also the facility can call hospice anytime, 24 hours a day, if there's a concern, and they will send out a nurse or you know, some other medical professional to check on the resident. Typically it is a nurse, it could be the social worker. The other thing that hospice will provide at end of life is somebody to be at bedside with the resident to make sure they're comfortable. If someone is having pain or any sort of distress, hospice provides for somebody to be with that person at bedside to make sure they're as comfortable as possible. So that can be very helpful. And hospice is paid for by insurance, just to mention that. It's a benefit of all insurance plans. And one thing to note is, regardless of your insurance, at end of life, you have a choice in hospice. So even if you are on a specific health plan, like Kaiser, for example, you do not have to use Kaiser Hospice. You have the right to use any hospice you like. So, and there are multiple, so it's worth looking into, you know, when the time comes, if you need that, which one is going to best suit your needs. Okay. It's sort of strange at the end of each slide not to say any questions, but Amy's more practiced at this. I'm getting used to talking to a screen, so forgive me.
We will. We will be pausing for questions, and it'll feel much more natural then. Yeah.
Thanks, Amy. So the realities of residential care, other considerations, frequency of visits. The frequency of visits really comes down to your comfort level. As Amy mentioned earlier, some communities will recommend not visiting for the first week or two. That's really up to you. The facility can recommend it, but you don't have to do that. It's not a hard and fast rule. If it's going to cause more distress to you or your resident by not going in, then I don't think that's a good choice. The one thing I would highly recommend, though, is not to take the resident out of the facility for the first, you know, at least a couple weeks, maybe even a month, and certainly not to take them home. I can remember a situation where, you know, a resident was having a really hard time settling in, and we found out that every day when her husband would come visit, and he said he was taking her out for a ride, but every day he would take her back to their house for a couple hours in the afternoon and then bring her back to the facility, and she just couldn't stand. Well, of course not. She was being so confused by being back and forth. You know, for all my years working in assisted living, I've seen families that are there every single day, twice a day. And then I had families that, you know, a resident lived with us for a couple of years and I never met the family, maybe because they lived out of state or whatever it might be. There's no right or wrong for the frequency of visits. It really is just what you're comfortable with. I will say if you can be in the community regularly, you're going to have a much better handle on what's going on with the resident. And it's always good if you can build relationship with some of the staff, and that's going to happen if you're in the community more frequently. But it really is up to your comfort level. Respecting the culture of the community. You know, this is a home to, depending on the size of the community, 6 to 100 residents. And it's their home and the staff's workplace. And so when somebody new comes in, that resident is having to integrate into the community culture. And that can happen easily, but we just have to remember that, you know, these people have lived there a long time and it is their home. If you go into a memory care community to visit at 7:30 or 8 o'clock at night, you might see residents walking around in their pajamas and bathrobe and slippers. And that's okay because it's their home. You know, the communities try very hard to foster an environment where residents are going to feel comfortable knowing it's their home. Communities try very hard to get the residents to treat their apartment like a bedroom. You know, we don't want a resident thinking that unit that they're in is their whole world. We want them to think of the whole community as their home. So just like in your home, you would see people walking around, maybe coming out to get an apple out of the fruit bowl at night or whatever it might be, or there might be somebody napping on the couch after lunch, and that's okay because it is their home. But I do understand it might be upsetting to you as a visitor, but I would just ask you to step back and remember that you're walking into the home of multiple people. So there are going to be times when a community cannot meet a resident's needs. And I recommend you talk with the facility at the time of move-in or right after. You know, what is going to happen? What would cause you to ask my person to leave your community? So there are a few things that are considered prohibited conditions through the Department of Social Services, which is what licenses assisted living communities. If somebody has a stage 3 or 4 pressure sore, they're not allowed to be in an assisted living community because they need to be monitored by skilled nursing professionals. A G tube, gastronomy tube, those are not allowed again. Nasogastric tube, a feeding tube is not allowed. Staph or other serious infections, these are all things that need to be monitored by medical professionals and are not allowed within an assisted living community. And a resident who depends on others to perform all their activities of daily living. And activities of daily living are things such as bathing, dressing, toileting. If a resident truly cannot do anything for themselves, they cannot be in assisted living. The resident has to be able to help in some small way with their own care. And this one is the one that really can be a little more gray. They really only have to participate in a very small way with their own care to be able to stay in assisted living. And tracheotomy, the resident in assisted living can't have that. Some of these, the exception is if a resident on hospice. And what I can say about that is if a resident is on hospice, they are able to stay in assisted living if they need someone to perform all their activities of daily living. That does make it allowed. And you can sometimes get an exception for the Pressure sores. If somebody has a pressure sore that's just not healing and we know it's not going to because they're on hospice and because of other conditions, you can apply for an exception through state licensing for the resident to be able to stay, but they're going to be one-off situations, and the facility staff will work with licensing on that to make sure that they can stay. The last thing the facility wants is for a resident to have to move, and especially at end of life, so they're going to help keep the resident comfortable, keep them safe in the community, but they are bound by licensing requirements. The other thing that will cause a resident to have to leave a community is if they are having behaviors that are causing harm to other residents or themselves, or there's the risk of harm to other residents themselves or staff. You know, facilities are just not set up for residents to be truly combative, and certainly if a resident puts their hands on another resident, that is unacceptable and cannot stay in a community. So they will talk with you and see about getting the resident moved. And the facility in all of these situations is going to work with you to help find a better placement for the resident. But ultimately, you know, if there's 30 residents in a memory care neighborhood, the facility has to look at what's the safest situation for all the residents. Financial issues. As I mentioned earlier, assisted living is all private pay unless you are able to benefit from the Medi-Cal waiver program. And so if a resident is running out of funds or unable to pay the bill, they won't be able to stay in assisted living. Here too, I recommend communicating with the staff. Don't wait until, you know, there's 1 month of fees left in the savings account to go to the staff. The staff might be able to help you. The administration might be able to help you. It might be when you moved into a 1-bedroom apartment, you know, privately, and that's really expensive. Maybe now, as time has gone on, you might be able to move to a shared apartment that could be much less expensive. And so the facility might be able to offer those solutions. I recommend talking to them about it. And the other thing we also see, especially in memory care, is that when somebody moves in, the room is very important, right? It's for transition, getting used to being there and having their private room is very important. But very often as time goes by, residents are spending less time in their rooms. They're more comfortable being out in the common areas, the living room, kitchen areas, with other residents and staff, and there really is just a bedroom. And sharing a room with another resident in assisted living can save you, you know, as much as $2,000, $2,500 a month, if not more. So I highly recommend talking with the community staff about that. And again, not waiting until you're out of funds, but as you see that coming, to see if they can help you with those sorts of things. Okay. So after you move your person into a community, there's going to be a few things that will happen. Immediately upon move-in, as Amy mentioned, there's the initial assessment where you're going to determine a care plan for your resident. You're going to work with the staff to determine a care plan. Does the resident like having showers in the morning or in the evening? Do they like coffee or tea? You know, they take their medications with juice, not water. All that stuff is going to be very important, and it's going to be in the care plan. And these documents can be lengthy. They can be 10, 12 pages, which is very important. The more detailed, the better. And for the rest, a facility will do a care plan meeting upon move-in to make sure that everything is agreed upon. Then typically they're going to ask to meet with you a couple weeks or 30 days after the initial move-in to work out any fine points. Well, you said your mom likes her showers in the evening. We found she prefers them in the morning, so that they can make changes and adjust in that way and keep you informed. And then typically they're going to meet with you about every 6 months to go over the care plan. Things do change, and they need to constantly be updated and amended to be current and make sure the resident's getting what they need. They will also ask to meet with you to do a care plan meeting if there's a change in condition. If a resident, when they moved in, they were able to ambulate with a walker, and now after a few months they've developed more weakness in their leg, they need a wheelchair. That's a change, so that's going to change things on the care plan. They're going to ask to meet with you. If there's an illness, if sometimes residents do better. Sometimes residents come into a community and they're very weak and not as mobile. Maybe they've been, not eating as well or drinking enough water, and they'll get a little strength back after they come into the community, and those needs are being met, so they'll need less care. A care plan meeting does not always mean that your fees are going up. Sometimes it means your fees are going down. If a resident is doing better, maybe they're able to do more than we initially thought, but they're really just about making sure the resident's getting exactly what they need in that moment of time. So they can change pretty frequently. The facility staff will reach out to you to schedule care plan meetings, but you can also reach out to the facility staff to schedule one. If you're seeing things changing with your resident and you want to have a conversation, absolutely you can do that. Typically at these meetings, you're going to see somebody from the nursing team, somebody from the care team, one of the direct caregivers might be there to tell you exactly what's going on. And depending on what the issue is, there could be somebody there from the dietary staff or the activity department, because the care plan really is about everything. It's not just the nuts and bolts of physical care. It's about meeting their emotional needs, engagement. So very often the activity staff is there as well. I've already mentioned communication. Communication, I can't say it enough. It's really, really very important, and it is a two-way street. I can't tell you how many times, I had somebody come to me and say, well, this has been bothering me for a couple weeks or a couple months, and now I just have to tell you. And I would always beg them, please don't wait. The facility staff really does want the resident and the family and to be comfortable. So don't wait, come to us with your concerns. If it's bothering you, we want to know about it. We might be able, or this community staff might be able to fix it, they might not, but at least they can talk you through what's going on. And the other thing is, administration tries very hard to be out in the community and know everything that's going on, but they need to hear from visitors that are coming into the community of what they're seeing to help them to do a good job for all the residents. And that's the thing, people I think sometimes worry, well, I don't want to be a squeaky wheel, but it's quite possible if you're seeing an issue with your family member, it could be going on with other residents, and the staff wants to know about it. So please come to them.
Eugenia, can I interrupt you again?
Sure.
Sorry to interrupt, but just again, a very topical question. Any tips on this, developing a partnership with the staff and the administration right now? It's very difficult. People can't be physically in there for care planning meetings during this time, as long as it might last. Do you have any tips for kind of maintaining that relationship from a distance?
Sure. I mean, it's the same as we're all doing. Emails, calling. You can call at different times of the day and talk to different staff if you want to get a perspective of what's going on. You could call in the evening and talk to the evening caregiver or the evening nurse. But this does want to hear from you and hear what's going on, and they'll be happy to tell you how your resident is doing. So, and from what I've heard from the people I know still in the industry, most of the facilities or communities have set up some sort of way to do Zoom or FaceTime or something, and you can do that with the staff too. You can schedule a time. I think now, because it is so busy for facility staff, if you have the ability to schedule a time for a conversation, you're probably going to be more successful than just trying to call and get somebody on the phone if you wanted to speak to the executive director or the nurse or whatever. But just because you can't be there in person doesn't mean you can't have those conversations. I would say some of the most successful family relationships I had when I was an executive director were people who lived out of state but would take the time to call and really ask questions. So yeah, I know it's tough. We all want that in-person interaction, but the facility definitely still wants to hear from you. And consulting with staff on decision making. Again, the resident is your person and you know them, but you know, sometimes families just come in and say, well, we're going to take mom out for the weekend. And, you know, we might want to sit down and say, maybe that's not the best choice. Or, you know, try to help with what's going to be the best for the resident in the moment. So if you have questions, you're not sure, you're thinking, maybe I want to do this for my resident, you know, the staff is there to help you with those decisions. Ultimately, they're your decisions. So whatever you do is fine. Just give the staff that information so they can help support the resident. And acknowledging difficult emotions. It's very hard. I mean, if you've been the person caring for the resident for years, and now you're turning this over to a group of people that are essentially strangers to you, it's really hard. I know I struggled with it for my family. You know, I had the staff calling and saying, well, your aunt is refusing to take a shower. And I got very angry saying, no, she wouldn't. She would never do that. But we need to understand that the person might do something out of character, because this disease sometimes causes that to happen. So, you know, you might be upset with the situation, maybe not with the person directly in front of you, but we all know that happens sometimes. So just do your best to give yourself a break and understand this is going to be really hard. But again, the facility does want to help you through it. Okay, so there are a few more practical things to think about. The community does have to have a disaster and emergency plan on record with the state. I will say that in my time as an executive director, we had to evacuate our entire community because of the wildfires, and it's something I hope I never have to experience again. But that disaster and emergency planning really came into play, and I'm so grateful we worked on that and had it in place. So this is also communicating with the staff. When you move in, you have to give emergency contact information, and the staff folds that into their emergency planning. So if you move, if you change your phone number, if you get a new email address, please notify the staff of those things. They need to have a way to be able to get in touch with you. Also, if you're going to be out of town for 2 weeks, and you have somebody else that should be contacted during that time that you're away, please let them know. During that same evacuation, I called to let a family member know we were evacuating, and I got us who answered from Italy saying, oh, there are fires? What? I didn't know about it. We're out of town for 2 weeks. We need to know who to contact in case of an emergency, and there needs to be somebody local. So always let the staff know about those things. Signing in and out is very important. In a community, you, of course, have the ability to take your resident out. You can take them out to doctor's appointments, to the store, to a movie, overnight, whatever you like to do. But please let the staff know for a few reasons. If you're going to take a resident out for more than a couple hours, it's possible that they need medications during that time, and the facility staff will have to sign out the medications for you to be able to give at lunch or whatever the appropriate time might be. Also, the facility will go and check on a resident. There are prescribed times throughout the day. They typically check on somebody at every meal time, a couple times in between, and during the night. If the facility staff goes to a resident room and they're not there, they're going to look around the community, and then they're going to see if they're signed out or not. And if the resident is not signed out, that immediately starts a search protocol, which the entire community staff will pretty much stop what they're doing, look room to room and around the grounds for that resident, and the police will be called. And that's because the facility is responsible for the safety of that resident and making sure that they're where they're supposed to be. I can also tell you there was a time that we had the police at my community, and they were walking out the front door saying, okay, we're going to call a helicopter and get out to start searching. And the daughter pulled in with her mom in the seat of the car. They had gone out for ice cream and she hadn't signed them out. It's a very serious thing. It's easy to forget because it's not something we're used to. You don't have to tell anybody if you go pick up your mom and take her for ice cream, but in this situation, it's really important. So also, don't be surprised if you're heading towards the front door with your resident and somebody's stopping you saying, "Excuse me, where are you going?" Because they are an alert to try to check that to see if you're going to be leaving the grounds. So very, very important. Tips and gifts for staff are not allowed. It's really important that there's not, first of all, you don't want to foster any sort of favoritism like, oh, Mrs. So-and-so's daughter gives me $50 every month when she comes to visit, so I'm going to take better care of her. But the other part of that is residents, especially residents with memory loss, might like to give a gift to a staff person and then they forget that they gave it and think that something's been stolen out of their room. So tips and gifts of any kind are not allowed. You can, if you want to bring in bagels for the whole team, you could bring in a box of candy for the whole team. Something like that can be shared, but no actual tips or gifts for the staff of any kind. And honestly, I can tell you from all my years of experience, the staff, any staff person appreciates most getting a handwritten note of thanks, that you appreciate the work they're doing and the job they're doing. So costs nothing, maybe takes a little more time, but it really is what staff will appreciate most. Okay. I always say, don't be afraid to ask for anything, but remember that the answer might be no. There are some things, maybe just because the facility is not doing it doesn't mean they can't, and maybe would be able to work out a way to try something, but there are some things they just can't do, whether it be because of licensing or because they have 100 residents in a community and 25 in a memory care neighborhood and something might just be unmanageable. But it doesn't mean you can't ask. It always should be open for discussion and for conversation. So really don't be afraid to go in and talk with the team. And when I say talk with the team, it's great to talk with the direct care staff and the people you see on the floor, but develop a relationship with the executive director so that they know who you are, so that you know who they are, and you have that open conversation and somewhat of a relationship. You don't want the first time you're sitting across from the executive director to be because there's an issue or a problem that you really need to work through. You want to have some foundation for a relationship first. Okay. So working with the community and making complaints, I already talked about this a little bit, but the staff wants to hear your concerns, your issues, anything you're seeing. They also, of course, want to hear the nice things that you're seeing going on, but don't be afraid to raise your concerns with the staff. And again, I would have families come to me and say, well, I've been telling the caregiver and it's not changing. Well, if you keep telling the direct caregiver and it's not changing, you need to go to the next person up on the hierarchy. Go to the manager of the department, the executive director, whatever it might be, but make sure you have your voice heard. Resident and family councils. There are resident councils in every community. The staff is actually not allowed to attend resident council unless they are invited to attend by the residents. So they're solely resident run within the community. And family councils are the same way. Families run those council meetings, and that's their time to talk about issues and maybe get to know some other family members. So I highly encourage you to attend if you can. You don't have to go all the time. You don't have to be on the leadership of the council, but attend and see what's going on, get a pulse on the community. The long-term care ombudsman, that's a volunteer position. The people will come out and they do an annual inspection of the community to check on certain things. They are also a resource for the community. Sometimes a resident will come to facility staff because they're having a concern with family, in a family dynamic, family relationship that the facility really can't get involved in. So the facility might call the ombudsman and ask them for support. You can call the ombudsman and ask them for support, and the resident can call them. There should be, or there are required to be, posters in every facility where you can find the contact information for the ombudsman. And then community, that's the Department of Social Services, who oversees all the assisted living memory care communities in the state of California. They do also come out for regular inspections. They're also the ones that you would call if you have a serious facility complaint, and they are required to come out and inspect, do a visit for every complaint that's lodged. So if you call and have a concern, somebody from state licensing has to come out and visit the community. You can also go on their website and check the community record to see what kinds of issues, complaints, concerns a facility might have. You can check their last, their annual inspections and see what their rating was, what any concerns were. I will say, if you're going to do that, read through the whole issues, the whole complaints, because as I said, every complaint has to be investigated. So you might open it up and see, oh my gosh, this community had so many complaints. But if you read through them, you might find that they're unfounded. It has to be documented there whether a complaint, excuse me, is founded or unfounded. And so I recommend you read through them. Excuse me. Okay. So Amy, am I turning it back over to you now?
Okay, actually, Eugenia, it's Jean here. So if it's okay, I've been looking here and see a few questions that folks would like to have answered.
Sure.
And I'm going to try and kind of group them together. Not surprisingly, there's a fair number of questions with regards to COVID and sheltering in place. So let me just start by saying, this question is, are memory care facilities required to inform the family of the resident of staff or resident COVID infections?
That is a very good question. And
Yeah.
I actually don't know the answer to that. I mean, my gut would
Neither
say,
do I. That's why I'm asking
yeah.
you.
My gut would say yes. They certainly can't tell you, excuse me, which resident. But in your conversations, Amy, I know you've spoken to somebody at one of the communities lately. Is that something fair to do?
I don't have the answer to that either. What I'm going to do in the chat, I'm going to put a link to the County of San Diego's website for the long-term care sector. The answer to that may be buried in there somewhere, but yeah, I don't know the answer to that either.
They would have to be reporting it to the,
oh, sorry.
they would have to be reporting it to the Department of Health.
Yes.
Yes.
Yeah. All right, here's another question, really for both of you ladies. And we're getting this question fairly often in our family services on the phones. And that is that, you know, families have moved their person living with dementia into a facility just before sheltering in place occurred. Mm-hmm. And now they're not able to see their family member, and they're wondering, you know, should we move our person back home? Should we move them out of the facility and back home?
Yeah, that certainly has come up a lot. It's a very personal decision, something, you know, that has to be decided upon by a family. You know, for some people, it might be a financial issue that if I'm not working, maybe I can't afford for my mom to stay in residential care. I would say, you know, really think about it. Issues you were dealing with before that person moved into memory care certainly aren't going to have gone away. And are you ready to be a 24/7 caregiver again? So it's certainly a consideration, but a personal decision.
Yeah, I agreed. There is another question that's kind of related on the topic of transfer trauma, right? Is that a real thing? If you move somebody between facilities, if you move them from home into a new facility or community, what is the risk of traumatizing that person? Yeah, transfer trauma is real, but it does happen in both directions. I think that's something that's important to know. If the person is getting good sleep, they're eating well, they're engaged with activities, they feel connected to the people that live in that community, moving out of that community, although there is risk of infection, carries its own risks in terms of the person's schedule being disrupted, routines being kind of out of whack. So I don't know that we can answer that question for any individual. I mean, I know we can't answer that question for any individual family, but there's a lot to weigh. I just want to add that on our blog, on the Alzheimer's San Diego, alzsd.org, we have a whole page of coronavirus COVID-19 related resources, and we actually have a blog post on this topic for people that are weighing that decision. So I'll refer you there too.
And also, as Amy mentioned before, you know, when you first move somebody in the community, very often you hear them asking, I want to go home, I want to go home. But what we've also found is that after living in a community for some time, if you take that resident back to their home, they're gonna still say, I want to go home, but they mean they want to go back to the community because their perception of what is home changes. And also sometimes when people are saying they want to go home to their home of 40 years ago. So, yeah.
Yeah, a good additional point was just made in the chat here, and that is that if you do, at this time, if you do remove somebody from a residential care community, either permanently or temporarily, they will have to do a 14-day quarantine before they can be reintegrated back into the community. So that is another consideration.
Right.
One of the other questions, again, in a related vein, is what Amy just spoke to is, you know, with the protocols that they have in the hospitals right now too, if you're, you know, mom or dad has to go to the hospital from the facility, you may or may not be able to see him or her. Our facilities, have they adjusted any of their protocols in terms of when a person should go to the hospital or not? In other words, I know you mentioned if a person falls and hits their head, they do, as per licensing, have to go to the hospital. But what about some of those areas where it's not governed by licensing, where it's gray?
Licensing licensing has a lot of gray, unfortunately, but they sort of expect the facility in way. It's going to be a matter of working with an individual physician. So there might be, you know, if it's not a clear 911, the facility right now might be more likely to try to get in touch with the physician and get guidance from them. But again, there are going to be situations where the resident just to go out.
Yes. You know, what I can tell you just anecdotally is that I've had actually several calls over these last couple of months where it does seem to be that if any resident is showing any kind of signs of a fever, they are sending them right to hospital to be evaluated for COVID. And that seems reasonable.
Yes. Yeah.
We've got a couple of other questions here that are interesting. This one is a new one for me. Why does the facility license number change each time there is a new executive director?
I've actually never heard of that because the facility license number is associated to the facility. The executive director has their own license. So the license number of the executive director is individual, but I've never heard of the facility license number changing. Now, a facility license number will change if there's a change to what's allowed under that license. For example, if there's change of ownership of the community, if it used to be, XYZ company owned it and now it's ABC company, the facility license number might change. So if they're adding a secured memory care neighborhood and so the capabilities change, the facility license number might change, but I haven't heard of it changing based on executive director.
Okay.
Yeah, depending on the site that you're using, some of them list the communities by the administrator's license number, and some of them list it by the facility number. So I think that might be what they're seeing.
Yeah, so it sounds like when you're looking at these things, you just have to understand that there are 2 license numbers associated with the facility. Mm-hmm.
Right.
There is a wonderful advocacy organization here in town called Consumer Advocates for RCFE Reform, CAR. So Jean, maybe I'll ask a favor of you, if in the chat, if you could pull up that link and send it out. They have a lot of good information about what you see in those reports and how to interpret them.
Yes.
In the interest of time, I'm going to suggest that we keep moving here, but we do still have some unanswered questions. We see them. We will do our very best to get to them. I just want to sort of get through the rest of the material here, and then we'll come back to answering more questions at the end, if that sounds okay to my co-presenters.
Sure does.
Okay, great. Yep. Okay. So we're not going to let you get away here today without spending a little bit of time talking about you and your well-being, caring for yourself in this journey, this transition after the person has made the move into memory care is critically important. By the way, I just want to say there was a question or a comment about the interchangeable use of the terms assisted living and memory care. So just in case there's any confusion out there, memory care is a specific type of assisted living. And so Eugenia and I, in conversation and speaking, we do tend to use them interchangeably. So assisted living is the broader category, and memory care is a particular type of assisted living that is secure, because it's so that individuals who are living with memory loss can't come and go freely as a resident in assisted living, traditional assisted living can. So just quick point of clarification there. So caring for yourself through this journey, we just have to acknowledge there's going to be some hard times. There's a lot of grief, there's a lot of loss, there's a lot of change, and there's going to be difficult emotions, including some positive ones. I think that's something a lot of people really struggle with after their loved one has made the move into memory care. They actually begin to feel some relief. They're sleeping better. Their relationship with that person is changing in some good ways. And then there's guilt around those unexpected pleasant feelings after the move. So difficult doesn't necessarily just mean bad. People struggle with the knowledge that it's time to resume their own life, right? To pick up activities, hobbies, those essential things that make you feel good, that keep you going, that fill your cup. It is important that you pick those things back up and resume your life. You may face some judgment from other people around doing that. That is to be expected. I wish it didn't happen, but it is in fact very common. You'll encounter people in your life who question your decision. But the fact is, you'll get pushback no matter what you decide, right? So you have to feel good about the decision that you have made, and try to set that judgment from other people aside. Establishing visitation schedules. We've been talking so far about working with the community staff to establish your own visitation schedule, but don't hesitate to talk to other people in your life about their visitation, right? Arrange for times for people to come and visit when you're not there. You don't necessarily have to facilitate that. Get to know the other residents. Eugenia made reference to this at one point. And in my years supporting families through these transitions, that's one common thread I've seen among the families that have made a very positive transition into memory care. is that the care partner, even though you're not there all day, every day, if you can get to know some of those other residents, if you can get to know not just the staff, but also the other residents' families and members of their support system, this is really going to ease your transition. You have knowledgeable people to talk to and to connect with, not only during those visits, but outside of those visits as well. So to that end, finding your team, knowing who's going to be your support system is really critically important. Give yourself the time that you need to work your way through this, to deal with these difficult emotions, to locate those people. They may be in your life now, and you just need to sort of reconnect with them and bring them in to be part of your support system. They may be new people that you don't know yet. Right? But give yourself time to make these connections. They are critically important. Adjusting to a new relationship with the person after they have moved. This is, in my experience in talking with many families and myself, having family members, having worked with people through this transition, this is the hardest thing for a lot of people. Your relationship will necessarily change, not necessarily in negative ways, but the relationship, whether it's a partnership, a spouse, or a life partnership, or a parent-child relationship, a sibling, if this is your child that you have placed, whatever the nature of the relationship, it's going to be different. So again, find that support system, talk through these challenging emotions, but some practical tips and strategies for making that adjustment. When you're making your visits to the care facility, this sounds a little strange, but not being overly sort of ebullient and energetic in your greeting, making it more casual. Hey, good morning, it's so nice to see you, right? Not making a point to sort of point out, gosh, I haven't seen you in a few days, I've really missed you, right? Being as sort of even in that greeting and in your communication as you can. I'll suggest we have our communication skills class that we offer regularly at Alzheimer's San Diego. We do it live regularly, but there's also an archived version of it on our website in our webinar library. I will refer you there for just tips and techniques for kind of practicing some of these different ways of communicating, really listening for what the person is communicating in terms of nonverbal, not the outside of the words that they're saying, right? If someone's happy to see you, just connect to the fact that they're happy to see you, and don't get tripped up in talking about how long it's been since you've seen each other, right? One of the really helpful strategies for making this adjustment is to join in on the activities. The activities are not just for the residents. You can be there too. You can sit and have meals together. You can participate in the games, the crafts, the outings, right? If that's comfortable for you. If you always connected together over, I'll use that example of music again. If that was a point of connection for you and this person prior to their move into residential care, continue to find ways to connect together over through those activities that happen within the facility itself. As with your greetings, I would recommend keeping your departures as sort of calm and even as they possibly can be. If there's a way, right, you know your person, and if your departing causes them concern or trauma or sadness, then work with the staff to coordinate that, right? If the staff can walk your person down the hall, get them on their way to lunch, and you can depart without having a conversation about it, so much the better. Again, just handling negative reactions that you may be experiencing, but also that other people in your life may be experiencing around seeing the changes in your relationship. Moving a loved one into residential care often does produce a new dynamic, not just between you and that person, but between you and other people in the other areas of your life. You may develop new friendships. You may develop new romantic relationships, right? There's no judgment. This is, there's a range of things that are possible for you and for the person who's living with dementia, now living in residential memory care. So just acknowledge that old relationships may no longer serve you, but new relationships, new friendships and connections absolutely are possible and should be pursued as much as possible. So again, the point is important enough. We can't emphasize it enough. Keep learning, keep coming to programs, find a support and discussion group if you don't already attend one. Attend those family council meetings, get to know the friends and family of the other residents. Finding that ongoing support is critically important. Acknowledge that especially if this person lived with you, if you lived in the same residence and they moved away, right, your day-to-day changes significantly, even if it's for the better, right? So recognizing we're all very aware right now of the consequences of being socially isolated, not just for people with dementia, but for you as a care partner as well. So please stay in touch with how you're doing, not only physically, are you sleeping well? Are you eating well? But are you noticing signs of anxiety, depression, or indications of social isolation? You may need to make some changes to your physical environment. One of the clients I worked with for years, after he placed his wife, beloved wife of many decades, in residential memory care, one of the difficult but important things that he did was changing the artwork in the house. Right, just making changes in his physical environment to better suit his own needs. Right, it was a lovely change that he was able to implement. You might have to learn some new household skills. You might realize when you're by yourself, you don't really know how to cook for one person anymore, right? Again, these are the types of things your support system can really help with. This happens a lot in our support and discussion groups. People share recipes and cooking tips and housekeeping tips with each other because we're all, after this transition, trying to learn these new practicalities of day-to-day life. And resuming your life, picking up those old interests and activities, or establishing new ones. Really encourage you to pick up the phone, have a FaceTime if you can't physically visit with somebody you need to reconnect with. If it's been a while, you've been pretty wrapped up in the day-to-day of caring for somebody who's living with dementia. Now is a great time to do that. It's very healing. Oh, so here, sorry, Jean, here is that organization. I didn't realize we actually put the URL in the slide deck. Consumer Advocates for RCFE Reforms is a wonderful local advocacy organization related to residential care. So all types of assisted living, that's boarding care homes as well as memory care communities. So they offer coaching, they can help you locate licensing information, and they also have a website that you can use to research and compare different facilities, including memory care communities. There are, of course, directories. You can reach out to people through social media channels to get their recommendations, but just be aware of the source of information that you're seeking and be a critical consumer of that information. So at Alzheimer's San Diego, we have a range of information and support that's available to you if you're researching memory care communities or you need support around making the move or adapting to this transition. So of course, our team of social workers, this is the most important resource that I can point you toward. Monday through Friday, 8:30 to 5, they're there to take calls, answer questions, get you tip sheets. You see the names and the topics of a few of the tip sheets that we can connect you with here. Finding care facilities, communication techniques, making that transition into residential care, or other topics as well. We can help you find memory care communities, find those placement and moving specialists, and maybe most importantly, help you locate a support and discussion group for connection and conversation when it's needed. So you can access all of this through our website. You can also just call the office. You can email us at info@alzsd.org. You can also live chat our staff right through the website. Lots of ways to contact us. And again, our office is open Monday through Friday, 8:30 to 5. So this is the range of supports and services that are available to you, all free, available to anybody who's impacted by Alzheimer's, other types of dementia, or any kind of memory loss here in San Diego County. We have an array of virtual services, our counseling services, support and discussion groups, our social activities, especially our movement and motion program, which is very well received now being delivered online. We have our volunteer tech team who's not only available to help during classes like Samantha was here today, but they can help you at home. If you're struggling with wanting to have FaceTimes or Zooms with your family, or you're interested in learning more about our virtual Alz Companions respite program, but you're not really sure, how would my person with dementia use Zoom? How would we do this? Our volunteer tech team can help you get that technology set up. And I'll just tell you, we've seen some beautiful success stories around that so far. We can get you, if you are in need of more facial coverings, we have an amazing group of volunteers that are sewing furiously for us, and we can get some to you. Just give us a call and ask for those, and we'll put some in the mail. So we are, if you're not familiar with us, we're a local nonprofit organization supported entirely by our community. So our staff is all here, our board of directors is all here, and all of the money that we raise stays right here in San Diego County to support our local families. So I am going to take some questions. We're right up on our time, but we're happy to stay a little bit longer and address those final questions. Just want to let you know that when you leave the webinar, you will be sent a link to a quick survey. We would love your feedback on the program. Always looking to improve our online education. Would love to hear from you. It's quick and it is anonymous. So please share your feedback. Here's information about our next 2 online education programs, as always, free and open to anybody. Talk on brain health next Tuesday, and on Thursday, a clinic on using movement and motion, sort of physical activity, exercise, doing things during the day to improve your quality of life as well as the person with dementia. So all of this information is on our website. So with that, I will ask Jean to share any other questions that have come in.
Yes, let me just see. So this is a good question that is a fairly common one that we get on the phones as well too. Could either of you ladies clarify about a resident, that has some type of dementia and needs help with all of their ADLs, their activities of daily living, but they don't need medical care. But the question is that they cannot be in a memory care facility for whatever reason. Where would this person go?
That would then be a skilled nursing placement unless hospice comes into play, and they could possibly stay in the memory care, but it unfortunately is a skilled nursing placement.
Yeah, okay. And that's kind of how I read that too, is meaning that the finances weren't there to pay for memory care. This one is a good one too, and I know applies to lots of folks. So this is a family that is talking about placement. They've talked to some facilities, and the advice they're getting from facilities is to, move mom now rather than later, that it would be easier for her to make the adjustment now rather than later when her memory is worse. The family's always had this idea they would wait until it was really, her memory was a lot worse before they would move her. And right now mom is saying she doesn't want to move. So what's your advice on that? Is sooner rather than later better or not?
I always recommend sooner rather than later to allow the resident to have some time to enjoy the community, to take advantage of the amenities. All these are personal decisions, and it has to be what you're comfortable with, but it's going to be an adjustment regardless of when a person moves to the community. So I always look at what's the best outcome. It might be a hard transition, but if the person's able to benefit from the activities and socialization for some time, then that's a benefit.
Sure. And, you know, Eugenia, you know, I certainly saw when I worked in memory care, and I'm sure you did too, that when we had folks that came in a little bit sooner rather than a little bit later, we often found that after that transition time, that they really thrived, that they really did well. They got very engaged in the activities and such.
Yeah, we would see that too. And, you know, I've also had residents who thoroughly enjoy their time in assisted living or memory care, but when their family comes in, will still, after years, say, take me home, get me out of here. And sometimes that's a reaction to the family, but people really can settle in and enjoy. And sometimes the residents that are a little more physically able get pleasure from being a helper to the other residents, being
Right.
them. And, you know, if the facility staff is attuned to that, they'll work to that and say, well, but can you please help by, you know, talking with Mrs. So-and-so, she's having a bad day. Regardless of where we are, we need to feel needed and useful. And for those residents that are a little on the early stage, they can benefit from the community by being useful to the other residents too.
Great. And just a general question here. How might any of us answer this? You know, families who are having some heated discussions and are in disagreement about a move to a care facility or not. Some in favor and some disagreeing. What's our advice for this family?
Well, somebody's always going to be the bad guy. And, you know, that's really what it comes down to. And that's why when dealing with they're always going to say, okay, who's your point person? A facility can't poll a committee of 5 children to find out what the decision is. So hopefully the parent or whoever the resident's going to be has chosen one person to be the ultimate decision maker. And if you're that chosen person in the family, you have to grow some thick skin and know that you're doing the best thing you can for the resident. And, you know, they always say it's an honor to be chosen, right?
Sure. And, you know, I mean, the other thing is for any of these families is you call us at Alzheimer San Diego. You know, we've got our social workers that can set up family meetings to help people kind of walk through some scenarios and talk it through.
Recognize too that especially long distance families, this kind of dissent can happen in local families that are all close by too, but it's especially common when the people who disagree with the primary caregiver and their decision aren't local, they're not close by. It's a little difficult today in our current circumstances and environment, but if there's any way to get those folks out here, right, let them hang out with you guys for a day or a week, right, and see what your day-to-day existence is really like and talk with them about how this might look different in a residential setting where a person is getting more regular sleep, more structured activity, where the staff are fresh and, you know, they work for 8 hours and then go home and rest, unlike you as a 24/7 support system. So you may be able to convince other members of the family, other members of your support system that you're making the right decision. But I'm very much with Eugenia on the, rather than counting on convincing them, working on thickening up your skin and making the decision that you know is right for your family.
I think that's it, ladies. We do have a couple more questions have come in, but I think we've gone a little bit over.
Yeah.
Remind everyone that you can call our number at 858-492-4400 and address your questions to our team there at, I say there, here at our office, my office, Amy's office. All of
Our offices are currently spread all over San Diego County, but
We have 23 locations to serve you.
That's right.
That's funny. Well, thank you. We know we didn't get to every question. As Jean said, please reach out. We are here for individual support. We're happy to talk you through your specific situation, connect you to those resources that you need. Thank you for tuning in here today and your great contributions and questions. It's been really wonderful interacting with all of you, and we hope to see you at another program soon. Okay.
Thanks, everybody.
Thank you. Bye.